First panelist, we'll have Dr. Sonal Asthana. Dr. Asthana is a hepatobiliary and a transplant surgeon with extensive experience in leading centers across North America, the UK and India. Questions that patients and their families have when they're informed they need to seek treatment away from home. And what does that decision-making process look like, and how do hospitals provide support to help them make informed decisions?
I think this is an important question to answer, and especially for a country like India where healthcare is still concentrated in pockets of excellence. So if you get healthcare in the best places in India, it's probably better than the best in the world. But not everybody can access this because of reasons of geography and logistics. And certainly when it comes to something specialized like transplantation, which is what I do, the centers that offer that are very few and far in between. So people do seek out care from within India and from outside of India, and they look at centers, they kind of do the research to identify places where they need to travel. So now consider the situation, suppose you're a middle class family, say in Orissa, whose child is diagnosed with a condition that needs a liver transplant. One, you obviously want to save a child, you want to make sure he or she gets the best care possible. Secondly, you are trying to find perhaps a place to stay in Bangalore, Delhi, Mumbai, or some center that actually offers this. And then how does one go about it? You try to identify networks, maybe reach out to family and friends who might be living in these places, and then see how they can help you. But clearly those networks are stretched thin. If you have to go for long-term care like oncology or transplant, you have to spend 3 or 4 months away from home. So it entails relocation, it entails loss of income, it entails loss of professional networks that could, or social networks that could actually support you. So these are huge factors, and these are probably the primary factors which deter people from seeking help. And we have seen this quite often when we say, for example, start a satellite center or a clinic which is far away from Bangalore. The number of people who seek our help is almost 4 or 5 times the number that actually make it to Bangalore, because they probably decided that these hurdles are probably not worth it. They're insurmountable for them. It is quite overwhelming for young families to actually think about these factors. Regarding what hospitals do, it's clearly not enough, because hospitals are not made for this. Hospitals are made to be centers of excellence. They are excellent at providing acute care. If you have trauma, if you have cancer, if you need a transplant, we are your guys, right? Solving social problems, not so good. So I think that certainly we need to, this is why this initiative is so important, because we need to work together with civil society, with NGOs, to provide the ecosystem that's needed. Because it's not like we cannot give the best care in the world. It's about how do we empower people and make it accessible to them, not just in terms of the skills, but also the logistics.
New city for treatment, and how can they be better prepared for this change?
6-year-old child or an 8-year-old child or a 10-year-old child or a 14-year-old child wakes up one morning, who has been spending time with his or her friends, suddenly wakes up in the hospital, is isolated, is spending nearly 180 to 270 days out of school, out of the environment that he or she, he is familiar with, and spending it more or less in a hospital for treatment. School is something that is like an anchor for these kids, and suddenly this anchor is missing. So what happens is the child is lost. In addition to that, what happens when it is a child who has to come for treatment to cancer, like Dr. Asthana said, moving out of the city or the place that you're living in, coming to a different place, the entire family gets uprooted. So it's not just the child, it is the child, the siblings, the parents, or even the grandparents sometimes. Sometimes it is like a divide and take care kind of thing. Grandparents stay with the other siblings while the parents bring the child for treatment, or vice versa. Many different permutation combinations of which family member comes with the child for treatment. Now once they come to the city, school is lost. They're coming to a completely different place. They're coming to the hospital. The fact that they're coming in for treatment itself is a daunting experience. And then suddenly you realize that you don't even have your academics that was a major part of your life. So it is a very, very difficult situation, both for the child and the caregivers, because for the caregiver also, he or she has to make that balance or help the child to settle down in a completely new environment.
Dr. Shalini, we would love to hear, in your experience working across the UK and India, what have you seen as to be the differences when it comes to delivering news to patients and those initial conversations that you have with patients, caregivers, and their families, especially when it comes to younger or sometimes even much older patients?
Milaap and ICAT Foundation and ICAT Air Ambulance has been we have been working together for a long time, especially during COVID and after COVID as well. We have done a lot of COVID-related work in terms of providing under a campaign called COVID India campaign with me and Sudeep Pilarisetti. We both kind of headed a campaign where Milaap played a great role bridging the gap between the donors and the ICAT Foundation and COVID India campaign. I can speak about the campaign for almost 3-4 hours, but one of the most important one was SOS, that is Save Our Saviors, where we provided N95 and masks, because I just wanted to highlight the work we have done together as well when you're all here. And along with that, we adopted 10 ICUs across Karnataka. We trained the doctors and ICU staff how to manage patients. Along with that, we also ran Breathe India, where we used to convert every 48 hours, we used to convert one oxygen isolation center into oxygen center with training and medications. So, and now Milaap has been involved with few of our patient airlifts as well. So coming to the point about delivering bad news, I would say straight on to that, the training is what plays a major role here. So when we are training the UK, although we are anesthetists, where we hardly ever speak to the patients, just we speak to them before anesthetizing them when we do our pre-op check, but after that, we hardly ever get to speak once we get the patient, wake them up, send them to the ward. Having said that, we also do a lot of critical care, and we come across these miserable diagnoses where we have to break this bad news to the families and patients and friends sometimes. There is a special training for that, entire exam module of ours is on communication skill. We can be the most the brilliant student getting full marks in our clinical examination in our theory, but they fail us if we don't do our communication skill well. This is the important that is given in a fellowship examination, that is one of the toughest examination in the world, they say UK fellowship exams, where communication by itself is a huge part of our exam. So you can imagine the training we have to go through to be a good communicator, and the way we sit down, the way we make the eye contact, the way we get some tea for the family, pull the screen across, maintain privacy, and then take that, because that is the moment where their entire world is going to turn upside down. And from there on, until they reached a certain stage of getting a transplant done or a curative therapy or something, their life is going to be tumultuous. You can imagine if you get a fever and you can't go out for one weekend, if you can't get out or you miss few meetings, you feel so bad, as if the entire world has come to a standstill. But here, people go through this for years together, so the families have to hold on to that. But the initial diagnosis is such an important thing in communicating that. I think we have to inculcate that culture of communication in India. I have seen some of my relatives and friends who got the bad news about their cancer diagnosis, or one of the child being kidney failed or liver's gone, congenital heart disease, being so badly communicated. I don't blame on the anyone, but I think it is the training. End of the day, it's the training. Training makes a lot of difference.
What thoughts and challenges do they encounter when it comes to moving away from home or moving to another space for treatment? And how can we bridge that gap when it comes to access to information, for services, for treatment, and just care support?
Thank you, Milaap, and thanks. Been privileged to sit with such big people who have been doing tremendous work here. So when we are speaking about migrants, in normal terms, most of us are migrants, right? Most of us. If I ask people here to put up your hand, I think so. It should be more than 80% of them would have put up the hand. This is what you call a scene of any metro around the world. But we work with the migrants who are on the lowest on their socio-economic cycle, the ladder. So when we speak about them on this front, first thing is what hit them hard on the face is the loss of income. The income is lost. Now, see, they are coming from rural, somewhere remote part of Karnataka or somewhere northeast India, what we have seen in Bangalore here. they do some daily wage earners, or they have their land or some kind of a shop or something on their own. So they have to shut down that and come. So immediately that is gone, closed now. And when we are speaking about something like cancer, transplantation and something, you don't know what is the tenure, like how many months you're going to be here now. And then what happens when coming here now, how are you going to fund that? How are you going to finance that? So that is another biggest thing which kind of they get stuck. Then, and someone telling them you have to go to Bangalore, Delhi, Mumbai. We being educated, when we land up in some of these big cities, I mean, the Uber driver doesn't come or takes a different route, you know how we feel. Then imagine when these people come, they'll be taken for a ride. So that fear of unfamiliarity, fear, those things. Then, and most important is, somebody has told them this is the health issue and you have to get it going to Bangalore or Delhi, whatever, but they don't know exactly what that disease is or the issue is and what is the treatment. So because here plays a very important role is the language. So even like, I might think I'm speaking in Hindi, I might speaking in their Kannada or Telugu, Tamil, but their rural language, their culture, this thing, and my way of communication are very different. So this is something that they face on the face, but for that I think so we should, like how we have something, a book like this, or a kind of a knowledge center, or some, you should have a district at a taluk level, you should have a centers where satellite, something doctor was telling about satellite centers where they're going to prep them up.
What have you seen to have worked? What have you seen to be the challenges?
Got it. So I'll start with a small story per se. So this was, I think, sometime pre-COVID, I think sometime around 2019 or so. And this was a family, I think, was living in, in central Telangana, AP region at that point in time. And the child was diagnosed of requiring a liver transplant, and that was essentially to be done in one of the centers in Bangalore or Chennai, so to speak, right? They were in. And the family is a very well-to-do sort of they were farmers, but they had their own land. The father had an SUV and so on and so forth. So it's not, we're not talking about somebody who is poor, so to speak. What they initially, their awareness was that, okay, the cost of the transplant and the treatment, etc., everything around hospitalization, they had a good idea. But what they did not factor into it was how much would this sort of extend, prolong in case of scenarios where, it doesn't go by the plan, so to speak. And this is a case to an extent where I know that, that the child had to get another transplant because the first transplant was not a success, etc. And I remember the father essentially sort of, because I was talking to him, I said, the father essentially said, we had crowdfunded, he had come for crowdfunding, and we were discussing as to why would you need and so on and so forth. He said, I need it. Everything else I've arranged. I even sold that SUV car that I had, and we've essentially arranged for it. I'm just looking for, I think he was looking for 4-5 lakhs just as a buffer because I'm in an unknown city, we do not know what it is, etc., just for our stay and hospital. And he was very, very clear. My child had lived at a certain level of comfort, and I want to ensure that during the treatment also, that comfort level is met. And this is somebody who is, you wouldn't call them as poor, right? By no means, so to speak. Upper middle class, but the challenge was essentially information asymmetry. So we talk about resource poor, and primarily we look at resource primarily from financial perspective, but information and awareness is an equal, if not a bigger, sort of a challenge that we have seen. And every single day, I think, like recently I read a research article that was published in 2023 around the financial toxicity of cancer treatment. And one thing that was very sort of evident was, in India we define something called as catastrophic health expenditure, which means If you're spending more than 10% of your household income, then it is considered on health, that is considered as catastrophic health expenditure. And this survey essentially said that around whenever a family member is diagnosed of cancer, the probability of that family facing CHE is 23% if you were to look only at the direct costs, which is essentially the treatment, the hospitalization, the medication, etc. But it becomes 60% when you include the indirect costs. And more often than not, the major part of that cost is essentially around travel and lodging. So basically, people who are traveling from one part of the country to another are at a higher risk of facing, going below poverty line or having to sort of sell their assets. And not primarily because of hospitalization expense. Of course, it's still a challenge, but there are enough schemes that are coming in, there are enough sort of initiatives that are coming in to buffer for the treatment costs. But what we are seeing is, the indirect costs. And when we say indirect costs, it's not just about money per se, right? Like he mentioned, the loss of income, right? When we talk to people, patients who essentially sort of, finish their treatment or during their treatment, and we just ask them, okay, apart from this, how else can Milaap help, right? And we were hoping that they would say something else. I think at least 7 out of 10 times the parents say, is there a way by which I can get a job? Because this is going to be six to 9 months here, right? So I think all of those aspects, so when we look at financial, we are not just talking about the money outflow, but also the opportunity cost that comes along with something like a tertiary care.
In the case of a transplant, the other unique factor is that one of them has potentially might be a donor, might have donated part of their liver. So they themselves are patients trying to recover from, from surgery and get back to health issues. But money is probably the predominant factor why people don't do it. And I think the biggest irony in our factor is it's not a lack of money currently in India. It's about making sure that money is accessible to people who need it. So it's almost like a Lego set where you have to put things together. The hospital care is one of those parts, but the other things just need to be put in place as well.
As I explained that when a child comes to a new place for treatment, the child is out of school. Now, he spends so much of time in the hospital, and that is where an organization like Samisha Foundation runs learning centers, where we provide non-medical support through education, through spiritual activities, that is a very specially designed yoga with creative visualization, as well as creative play and fun activities, where learning happens all the time through these different activities. We have a robust library session. The other thing we have realized is that books are the best friend that you can have. So we have a very robust library reading program. But unfortunately, today's generation of kids don't want to read. Now, the other thing is that out of, the total number of kids that we cater to, 75% of them come from the rural sector. Or they come from areas where they go to schools which are basically local medium or language medium schools. Or they come from outside where they are, either if they come from West Bengal, something, they are Bengali medium, or if they come from Maharashtra, Marathi medium schools. Now, when they come here, first and foremost, it's a new city. Secondly, they are not going to school. Thirdly, they are coming to a hospital where there is a facility being provided for them. But if we provide them only educational support in English, it is not going to help them. So the only best thing we can do is try and provide them support in a language that they are comfortable with, which is their mother tongue or the medium of instruction that they've been going to. We cannot obviously do the entire school syllabus that they're missing out while they're undergoing treatment. So we have a specially designed program. We have teachers, volunteers who come in, work very closely with the doctors, because one thing is that while the child is undergoing treatment for cancer or nephrology, certain aspects of learning also get affected. So the pickup of the child also reduces. Now, as I also explained, that it's not just the child, even the siblings are out of school because of, having to come away from their original hometowns. So even those siblings, sometimes even caregivers we have been catering to. Now, we have had cases where the mother is completely unpad gawar. Like, as we say in Hindi, kala akshab has barabar. So, we had one incident, in fact, in one of our hospital learning centers, where the child was in bed and the mother was waiting, only the mother was there because the father was back home. He had to eke out a living to make sure that, the family is being supported. So the nurse called this lady for something, and she said, but I'm sure that some of you understand Kannada. Ask her to put her thumbprint because she could not sign. So this kid was watching her, and then after some time he got very frustrated and he told the mother, he said, Yenamma, neenu nan jote otta idya, nan jote idya, why can't you learn to at least write your own name? Why would you want to go and put your own thumbprint? So he called my teacher, my center coordinator, to the room, to the ward, and he told my teacher, he said, Madam, ನನ್ನ ತಾಯಿಗೆ ಸ್ವಲ್ಪ ಅವ್ರ ಹೆಸರು ಬರೆಯೋಕ್ಕೆ ಹೇಳ್ಕೊಡಿ. Teach my mother how to write a name at least. Let her feel proud that she can at least sign off. So 1 hour mein, she learned how to write her name in Kannada. Then very promptly she went to the nursing station and she signed there for the treatment that he was supposed to do. Then she comes back to the ward and then the boy tells the mother, ಅಮ್ಮ ಈ ಥರ ಹೋಗ್ಬಿಡಿ ಎಲ್ಲ ಕಡೆ ಸೈನ್ ಹಾಕಬೇಡ ಶೋ ಆಫ್ ಮಾಡೋಕ್ಕೆ, ಇಲ್ಲಾಂದರೆ ಆಸ್ತಿನೂ ಕೊಟ್ಬಿಡ್ತೀಯ. So that was in the sense that he said, don't sign off the property. You're so happy that you've learned to write your name. So these are small instances where we find that while the child is learning, even the caregiver is learning. We find mothers who very happily take part in our yoga creative visualization program because it's a platform for them to also basically de-stress. So the support system that we offer in the school, in the hospital, is not maybe the same support system as they would get in a school, but a lot more that is inclusive so that all the other aspects of their non-medical part of their treatment is taken care of.
How does day-to-day life look for the migrant community when they're trying to integrate into the rhythm of a new city, while especially when they've moved for care and medical treatment?
So I'm going to share 2 small things which happened with us in these communities. It's not a big treatment as cancer or whatever. This is a family moved out of Yadgiri. And if you see when you are roaming around the street, you see blue sheet tents. That is where they stay. That's their housing in Bangalore. This family, the 3rd child, was severely malnourished, what we call severe acute malnutrition child. So the government has a very beautiful program where this child we identify, refer it to the Anganwadi, and then goes to the NRC center at the Victoria and Vani Villas, where everything is covered. Even some basic 200-250 rupees also is given with all the treatment, food and everything. Looks wonderful, everything is fine. This is, as I'm telling you, this is the 3rd child. There is a 7-year-old and another 5-year-old child. So who's going to take care of these children now in Bangalore? The mother has to be with this small, around, maybe it was that 10-11 months old baby or a year close to. So even these 2 are like too young. So how they're going to manage this day to day in Bangalore? Because they've traveled, family travels only husband, wife and kids. There's nothing like grandparents, uncle, aunt, nothing like that. So this is there. Then another thing I want to share you is, thanks to COVID. Can you imagine I'm telling thanks to COVID? People came to know how the cities are with migrants, right? So there, when we started working on vaccination and these things, there are these huge migrant settlements on Outer Ring Road, Marthahalli. To our surprise, when we were working there, in a month, we used to see 5 to 6 home deliveries happening. And on the other side of the road, you have Microsoft, Intel, JP Morgan, Sakra International World Hospital, and behind that, every month 4 to 5 home deliveries. Then we had to get in and speak to them and to understand. See, if they know if they have to go nearby private hospitals, they have to shell out around. Normal delivery also will cost 30, 40, 50,000 depending on it. Then they have to borrow money or whatever. Otherwise, going to government hospital, this is all our north and northeast families. Anybody you go to Jayanagar General Hospital, Vani Villas or Victoria will speak to in Kannada. So how these are the day-to-day challenges. I'm speaking, this is what happens, and they kind of moreover, the financial, like doctor told, right? Some infection happens, then you have to go for additional tests, additional screening and those things. How do they manage? Then, and I mean, how do you commute from your place to the hospital where you are there? I mean, and again, I mean, you might go out of the city, but you look out for, I look out for where I can get idli and dosa. I'm a local Bangalorean. I go to Delhi and look out for that after eating parathas for 2 days. So imagine somebody coming from North India, what would they look for? But in our hospital canteens, you know what we get, and so these are the challenges, day-to-day challenges. Very, very small things, but it make a lot of difference over a period of time. So, I mean, they get stressed out. So, I mean, people who are educated tell we need mental health support and whatever, but these people can't tell that in that words or in that language. But what we go through, they also go through all this in a different form. That's a very heartening and very, things where we have seen people leave the treatment midway on this count.
And not very, very well educated, but like had access to internet, and so they figured it out that they can have a lung transplant done in Chennai. So they contacted us, probably again got our number through the internet, and then contacted us for her to be airlifted from Karachi to Chennai. So this was the first trip of our company going to Pakistan. So I'm sure some of you are UK returned, US returned. I'm very proud to say I'm Pakistan returned. So, of course, we knew the challenges of flying into Pakistan and bringing out a patient. Along with that, we had to deal with the clinical condition as well. And the families' concerns about coming here to India, getting treated, the hostility they might face. End of the day, that just made me realize that particular experience, patients are patients, no matter which part of the world they live in.
Well, I'm not sure about best practices, but I can talk about, I mean, for any ecosystem to sort of thrive, three things have to come together, right? The government, the private, and the third one is the civil society, right? 15 years ago, probably we can all say affordability is a challenge for the lowest strata per se, and I'm talking only about tertiary care, right? So my experience is limited to working on patients who require tertiary care, right? But by and large, when you think from affordability perspective for the lowest strata, there is still a missing middle, and there are stopgap solutions like crowdfunding, CSR, etc. per se, but the lowest strata, the 40%, so to speak, by and large is covered for when it comes to your hospitalization, treatment costs, etc. per se, right? Today, I've seen healthcare systems across the world, right? In India, in US, in Europe, and so on. If you were to sort of benchmark in terms, if you were to do a, axis, 3-degree axis of quality, cost, and infrastructure, so to speak, I would rank India as amongst the top per se, especially when you were to look at all three of this sort of put together, so to speak. So from a private perspective as well as from public infrastructure, but more so even from private infrastructure perspective, you have the best of the facilities, so to speak. And the third one that comes to us then is the civil society, so to speak. Now, most people essentially equate civil society to NGOs, which form the backbone for sure, right? But it isn't limited to just NGOs alone, right? Given what all of them have essentially spoken about, I mean, it is fair to say that the problem is humongous, that no one organization or no one infrastructure or no one particular government scheme or approach can sort of solve for.